for autism programs were actually wasted, abused, or just flat out stolen. Joining us now, Deputy Public Policy Editor of OpenTheBooks.com, Rachel O'Brien, with what went wrong and why taxpayers keep paying the price. So Rachel, these new audits found about $200 million in improper Medicaid payments. When you dig in, what does that fraud actually look like?
Yeah, so we've heard a lot about this fraud in Minnesota, right, in the state's autism program there. So there's also the Applied Behavior Analysis program, which these are Medicaid-covered autism services in several states, and they've been the victims of overbilling. So the 4 audits were in Colorado, Indiana, Maine, and Wisconsin. And so they found about $200 million in those improper Medicaid payments over 5 years. So this was done by the Department of Health and Human Services. They found that providers were billed or billing rather for children napping or eating, playing on tablets, watching movies when they're supposed to be providing them therapy, essentially. In Colorado, one provider billed for 151 hours of therapy in a single month. We saw staff without credentials delivered therapy across multiple states. There were some facilities where they photocopied their session notes to clone them between patients, or they signed before sessions even finished. And there were many children who never even received a valid diagnostic evaluation, but these providers made sure they got money. So none of these 4 states had ever conducted a review of the claims, a post-payment review of the claims before these audits. In other words, the programs operated on an honor system without any verification.
So put this in real terms for viewers. How much is this costing taxpayers, and how fast is this spending growing?
Yeah, so, right, these are only 4 audits of 4 states. There are more to come. HHS said they're going to do more. If you look at cost per household, let's say, in Colorado, it's about $35 per household was wasted on this, about $21 per household in Indiana, $79 in Maine, and just $8 in Wisconsin. So there's a lot more to come because there's only these 4 that we have right now, right? So if you look just at autism treatment in general, it has skyrocketed. So CMS reported back in 2019 that about $24 million had been billed to this set of autism treatment codes. It skyrocketed from 24 per month to 190 million per month in May of 2024. Wow. So it's almost an 800% jump in this monthly Medicaid billing. So you're going to see a lot more of this, nearly 8 times as much. And so there's got to be more work done here.
And this isn't subtle. We're talking about billing for nap time, for therapies that were just made up. So how do these kinds of things that are obvious actually getting approved and paid?
The short answer is there is lax oversight from these states that are running their Medicaid programs. So the Wall Street Journal, they did an analysis. They explained that this rise in the type of care has sort of outpaced the ability for regulators to keep up. So the head of that agency in Colorado, of the Medicaid agency in Colorado, they said there's no real guidelines, standardized guidelines. It creates an enormous area of expectation without explaining how to do so. Now, let's be clear. Obviously, if providers are, giving photocopies of these analyses for students, clearly that's fraudulent. So state and federal officials are working on clearer standards. They need to get that out. The audits also found, the same compliance failures repeatedly across these 4 states. Essentially, that providers could not produce these records that proved that therapy actually occurred, but they paid the claims anyway. So the problem is across the board. There needs to be some regulations put in place here. And until the Medicaid agencies at the state level can catch up and adequately monitor these providers, you're going to keep seeing taxpayers are going to get the short end of the stick.
All right. Deputy Public Policy Editor of OpenTheBooks.com, Rachel O'Brien. Some great information there. Thank you for bringing that to our attention. Hope you have a great weekend. Thank you for joining us.
Thanks for having me.